I'm Dr. Joel Slaven, and I'd like to discuss with you today the way we were able to replace missing teeth before the advent of implants. We only had two choices. If there was a tooth on either side of the missing tooth, we could make what's called a fixed bridge, which involves preparing the teeth on either side of the missing space to receive crowns, and the artificial tooth replacement tooth is rigidly attached to those crowns and then cemented into the mouth. This restores function pretty close to the natural tooth, but it has some downsides. Any tooth that has had tooth structure removed from it is going to receive inflammation to its living part, the pulp. And the pulp never fully recovers from this and leads to problems potentially in the future. The main one is the need for a root canal treatment on one of the repaired tooth. So you can see that the happiest tooth is one that's never had anything done to it, and that is the major downside of the fixed bridge, because it takes a one-tooth problem and turns it into a multiple-tooth problem. The other way, if we don't have space on a tooth on either side of the space, is to make a removable partial denture. A removable partial denture restores function, but it also has downsides. The clips or clasps that hold it to the supporting teeth potentially can damage these teeth, because even the best fitting partial denture still moves slightly when function is occurring or chewing. And this movement is very much like rocking a fence post. It can damage the supporting tooth, irritating the gum tissue and the bone supporting the tooth, and eventually lead to problems in the future. So the downsides of both of these treatments, although they're very acceptable treatments, still sometimes are completely relieved by the use of implants, which have become the standard of care for replacing missing teeth. This is proved out both scientifically and by our experience over the last 30 years. So, although the two replacement options I mentioned, the fixed bridge and partial dentures, are still completely acceptable, an implant-supported restoration, which will restore the tooth to almost exactly what your missing tooth was before it was extracted, is still the better option.